Good day, folks. Welcome to Just Omer, and my name is Omer C. Ahern Jr. I'm from Wentworth, New Hampshire, and I am a county commissioner for Grafton County, and I serve, I serve the entire county, but I'm elected from the folks in the eastern and southern part of Grafton County. You know, as far north as Campton and Warren and over to Canaan, and including down to Bristol and Alexandria and Ashland, and all the towns in between, and especially including Holderness, Plymouth, and Hebron. And the folks here at PBTV give me this opportunity to make a periodic, I try to make it weekly, report on what's going on in Grafton County government. And the Grafton County complex is up in North Haverhill, New Hampshire, and the Grafton County Commissioners, of which there are 3, we meet just about every Tuesday, unless there are 5 Tuesdays in the month, and then we don't usually meet on the 5th Tuesday of the month. But I serve with 2 other commissioners. The chairperson of the Board of Commissioners is Wendy Piper, and she's from Enfield, New Hampshire, and her district is District 1, which is the towns of Hanover, the city of Lebanon, and the town of Enfield. And then we also serve with Commissioner Linda Lauer, a Navy veteran, who is elected from the towns in western and northern Grafton County. So we meet like I said, every week, and we meet with the administrator of the county complex, which is Julie Libby, and she's a longtime servant of the people of Grafton County, working at the Grafton County complex. And so we met yesterday, Tuesday, the 1st of February, and which is a day that will go down in history, because that's when the former, I'm not a football player, but the former star quarterback for the New England Patriots, Tom Brady, announced his retirement. So that's going to be a day that's going to be written down in history. So yesterday, Tuesday morning, and we meet at 9 o'clock up at the county complex in North Haverhill. The first item on the agenda was Kevin Lowe from the IT coordinator for Grafton County. And these folks are I can't remember what the SNS stands for, just too many initials I've got to try to remember. I may end up seeing it on here. But he gave us an update on what's going on with the information technology department. And folks, one of the things that's very, very discouraging about being a county commissioner these days is the amount of money that's being spent on technology. He talked about some basic tools that are needed for cybersecurity, Arctic Wolf, antivirus, and Office 365. And part of that is taking advantage of the USAC program, which has something to do with rural healthcare facilities, getting some reimbursement from the federal government for some of this technology stuff. Forgive me, technology items. And one of the things that one of the reasons why we requested Mr. Lowe to come and make his report was because there was a request for just about $100,000 for some new IT equipment. and basically that's basically Office 365 and some of the other things. And this is on top of other things. So one of the things I'm going to talk about before I'm done this morning is the county budget process, the tentative budget schedule. And I encourage all of you folks out there to either attend our budget hearings, and I'll give you the dates, or if you can't make them in person, to attend via Zoom. Because I really would like to hear from you folks what your concerns are about, spending up at Grafton County Complex, with our nursing home, our Department of Corrections, and our farm operation. And again, our farm operation is designed to make some money selling milk, but also growing vegetables, and so we can, with the new farm doc program, feed the inmates in the House of Correction, which is about almost a $200,000 a year item in the Department of Corrections budget. So I'd like to hear from you, and I think the other two commissioners would like to hear from their constituents as to what's being spent. Some of the things we don't have any control over because the federal government has mandates that are coming down through Medicare and Medicaid and the Veterans Administration funding that we get to take care of our residents in the nursing home. And the legislature passes laws that we have to follow at the county complex. Whether some of those things are necessary or not, I certainly have my questions about some of these things, but I really would like to see more of the people in Grafton County taking an interest in Grafton County government. And you can attend the county commissioner meetings via Zoom. There is that capability. Just let us know, like the day before, that you want to attend via Zoom, and Samantha Norcross, the administrative assistant up there, she can make arrangements to make sure that Zoom information is out there to the public, and you can attend via Zoom. So, very eye-opening, that discussion by Mr. Lowe, and it was, yes, very, very eye-opening as he talked about cyber protection, networking, servers, cyber protection, cleaning up old technology that we're still somehow have at the county complex, organizing and relabeling things, and downloading with maps. So some of you out there, maybe some of you 5th and 6th graders out there understand this a lot more than some of us older people. So again, I would appreciate hearing from you folks. The next item on the agenda was Craig Labor, the nursing home administrator, and he just came in to give us an update on the COVID situation at the county nursing home. Let me find my notes, because this is Craig's regular monthly meeting with the commissioners, and I thought I had that with me here in front of me. Somewhere I do. Bear with me. Yes, here it is. Our present census at the nursing home, we have 1 Medicare resident. We have 75 Medicaid residents. We have 2 Veterans Administration residents. And we have 20 private pay residents, for a total of 98 residents in our nursing home at this time. We did have 2 deaths last week, neither of which is COVID related. We were expecting to have 1 admission later on this week, and the number of folks that we can have in our nursing home, we have 100 and I believe it's 135 beds in our nursing home. So, but because of COVID and things like that, a number of our nursing staff, housekeeping staff, dietary staff are not able to come into work. They're in quarantine, and so as a result, we don't have the full staffing that we need. And I'm going to talk with you a little bit about that because of the report that we've got from the Human Resource Director. So yes, 98 people in our nursing home is a low census. It's concerning because that means I think we plan on somewhere around 120 residents in our budget. Again, even though we're a 135 bed facility, we always seem to have empty beds, partially because people pass away. When you come to the nursing home, sometimes you're toward the end of life, and so you never know. We never know when folks are going to pass away. Again, I want to just reiterate that since early April of 2020, we had one COVID-related death in early April of 2020, but since then, we have had no COVID-related deaths in the nursing home for that time period to today. And we thank the good Lord for that, and we thank also the very good work of our nursing staff, housekeeping staff, dietary staff, and environmental staff to make sure that we're providing the best care for our residents. Your parents, your grandparents, your aunts, uncles, brothers and sisters in some of your situations. So again, we keep very diligent. Craig and his staff and his team are very diligent in wearing masks, and we are now subject to the federal mandate, vaccine mandate, that all of our nursing home staff and any of our staff that come into contact with residents in the nursing home must be vaccinated if we are to continue to receive our federal funding through Medicare, Medicaid, and VA. Even though that there was a Supreme Court case that came down and said that businesses don't have to comply with the vaccine mandate under the OSHA regs, because the nursing homes are under the CMC regulations. Our nursing home employees are subject to the vaccine mandate. And there are some of our nursing staff that are leaving, some of our dietary staff that are leaving because they requested exemptions either for personal reasons, religious reasons, or health reasons. And under the federal mandates, they cannot be exempted. So, Mr. Labor, Craig, gave us, as I said, this is part of his commissioner's report. And again, he talked about the CMS mandatory vaccination implementation update. At this point, he reported that most of the residents are vaccinated, but not all of them. They are now using the KN95 surgical masks in the nursing home. Yes, and we are dealing with that the Omicron variant of the coronavirus, and it's just an ongoing thing. And all we can do is do the best we can. And again, we are very fortunate to have Nursing Home Administrator Craig Labor and his outstanding nursing staff, dietary staff, environmental services staff, and housekeeping staff for what they do. They do a great job, and we're very pleased and proud of those folks. I guess the next issue, the next challenge that the nursing home is going to have is if and when the CMS, that's the Center for Medicare and Medicaid and Medicare Services, are they going to be requiring mandatory booster shots? And we have been advised that some of our employees will say no to any booster shots. So this is definitely an issue that we have been dealing with at the county, since March, February of 2020. So that's the report from the nursing home, and again, Craig Labor, the nursing home administrator. The next presentation at our meeting yesterday was Karen Clough, the Human Resource Director, and she gave us our employee update where we are. She gives us a report on our new hires, separations, generally the reasons why people get done, active leave of absences. Most of those are for the Family Medical Leave Act. And then posted, advertised job positions that are open at the county. So we had 4 new hires at the nursing home. One was a full-time unit aide, 2 full-time dietary aides, and 1 part-time dietary aide. We had 2 hires at the Department of Corrections, 2 full-time corrections officers. We had we hired a full-time records clerk at the Registry of Deeds. We hired a part-time bailiff in the Sheriff's Department to be working over at the county courthouse. And the maintenance department hired a full-time maintenance assistant. However, don't get too excited, because when you look at the separations from the nursing home and the Department of Correction, there's really no net increase in the number of the employees, especially at the nursing home, which, again, as Mr. Labor was pointing out to us, that creates some problems. So we can't have the full amount of residents in our nursing home that we could take care of if we had full staffing. So we had 13 folks leave the nursing home employment, 5 part-time and 8 part-time, 3 part-time LNAs, 7 part-time dietary aides, 1 per diem registered nurse, 1 per diem licensed practical nurse, and 1 part-time housekeeper. And then we had 2 corrections officers, 2 full-time corrections officers leave the Department of Corrections. And the various reasons are personal reasons, no reason given, 2 terminations, 2 career changes, 1 going into daycare and 1 going into law enforcement. 1 left because of the vaccine mandate. They didn't want to have the vaccine. 1 went for a new job. 1 is going off to school. And then we had 8 because they were not meeting the per diem / part-time requirements. And then we have 26 employees at the county who are out on under the Family Medical Leave Act, FMLA. And so today, Mrs. Clough reported that they're going to be training or orienting a new full-time unit aide for the nursing home. So currently, these are the positions that we have open at Grafton County. We have 15 full-time equivalents for licensed nursing assistants. We're looking to fill 15 positions there. We have 15.85 full-time equivalent RNs and LPNs between those two professions, 15.85 RNs and LPNs that we need. We have 1 RN per diem at the Department of Corrections. We have 9 full-time equivalents for corrections officers at the Corrections Department. Looking for a housekeeper, full-time and part-time. We're looking for an evening clinical assistant. We're looking for a dietary aide, a part-time night watchman, and an activities aide. Now, the other major item that has been kind of in the back of our minds going forward is a number of months ago, the county commissioners and the county delegation executive board approved a wage audit, and to find out, if our wage schedule is one of our reasons for having difficulties meeting our employee needs. So we expect that we will have that wage audit presented to the county by the end of February, the end of this month. And that wage study is, we don't know what it's going to say, but we imagine it's going to have some very important information for us to consider and for the delegation to consider as we work on the budget. So stay tuned. Stay tuned. So if you know anybody that's in the nursing profession and corrections, interested in being a corrections officer, there are a lot of training opportunities, educational opportunities up at Grafton County for folks that are interested in becoming nursing assistants or LPNs, and we can help provide some scholarship money for that. And I will tell you this, and we just heard 2 videos yesterday. These are videos that the Human Resource Director put together to, their employment videos to encourage people to think about coming to work at Grafton County. And when you listen to the employees talk about, how fulfilling it is to work at the nursing home, they talk about it's a family there. It's like you're meeting with your grandmother, or in some cases with your mother, there every day. And it's just a very wonderful environment to work in. And every one of them said the benefits, and the corrections officers said the benefits, the health care, the dental, these and retirement are absolutely outstanding benefits. So that's one thing to take into account if you come, and make a career out of working at Grafton County. And a couple of the people that are videoed, they talk about they made their career at Grafton County. So the next item that I want to mention to you, we had a request from Jim Oakes, our maintenance superintendent, for some more electronic equipment, but this is safety equipment. So we approved it. It was for one of our a part of our county complex. It's designed to provide safety for our county employees in that particular department. I guess one thing I should have mentioned to you is some of these things are being paid for by the ARPA funds. But the ARPA funds aren't going to be there forever, and some of these things that are purchased, as with all technology, the technical equipment wears out, and it's got to be replaced. And when the federal money, which is your taxpayer money, when that's gone, it's going to be, the county's going to be looking to you taxpayers to replace these things. So keep that in the back of your mind, and this is what I'm doing as I approve these things, or not approve things, is what is going to be the long-term implications for the county. Are these things that the department heads are requesting, they may be ARPA eligible, but are they really needed over the long run? And so these are some of the tough questions that the commissioners are asking. Some of the requests by the department heads, the commissioners are not approving, but that doesn't mean that the County Delegation Executive Committee won't approve those requests. So we did approve the request from Mr. Oakes to get this safety equipment, and that was a 3-0 vote to approve that. So I said to you earlier in the meeting that I would let you know what the upcoming budget schedule, it's a tentative budget schedule. And so on Thursday, March 17th, 9 o'clock in the morning, starting at 9 o'clock in the morning, we will be meeting with the department heads for human resources at 9 o'clock, the extension service at 9:30, alternative sentencing at 9:45, the register of deeds at 10:15, the county treasurer at 10:45, the conservation district at 11 o'clock in the morning, and the commissioners and miscellaneous needs, which will be presented by our county administrator at 11:30. So all of these departments are going to be making their initial budget requests. On Thursday, March 24th, at 9 o'clock in the morning, we'll be starting with the Department of Corrections. 9:45, we'll be going to the farm. 10:15, the maintenance department. 11 o'clock will be the dispatch, and 11:30 will be the sheriff's department. On Thursday, March 31st, at 9 o'clock in the morning, we'll be starting with the nursing home. Then at 10:30, we'll be meeting with the county attorney, and she will also be discussing the victim witness program besides her county attorney office. 11:30, we'll be hearing from the information technology people. Again, that's scary to me. And then at 12 o'clock, we'll be hearing from the human services and social services agencies that come from the outside and requesting taxpayer money. And that's one of the areas where the commissioners look to see what are these services that are being provided by these human service agencies on the outside, social service agencies on the outside. We're looking to see if what they do will allow people to stay at home longer, so they're not coming into the nursing home under Medicare or Medicaid, because it is cheaper in many instances to keep your loved ones at home with the appropriate, proper care and services, which a lot of these social service agencies and human service agencies do provide. And then on Thursday, April 21st and Thursday, April 28th, the commissioners will be meeting at 9 o'clock in the morning to go over all of those different programs that have been requested in the previous weeks. So if you're interested in attending a commissioners meeting, call the commissioner's office at 603-787-6941. 603-787-6941, and you can tell them you want to attend these meetings. Again, I'm Omer Ahern Jr. This is Just Omer. I want to thank the folks again at PBTV for letting me make these presentations. And at this point, I just want to say God bless America and God bless the great state of New Hampshire. Live free or die. There are a lot of things worse than death. Thank you. Have a good rest of your week.